Continuing the discussion on the COVID-19 vaccine and the importance of staying informed. As you ask, we answer. We are joined once again by Trinity Health of New England's Dr. Syed Hussain. Good morning to you, Dr. Hussain. You're coming from Morocco this morning.
Morning, I am, yes.
All right, well, let's go ahead and get started. So, Dr. Hussain, Thanksgiving is over now. So what should we expect as far as, the numbers of cases being reported in the weeks to come?
So we have to keep a close eye on this. Unfortunately, the trend, not only in the nation, but globally, is on the wrong trajectory. So it's basically what that means is cases are rising. And if you're one of those individuals that are not yet vaccinated or you're due for a booster, now is the right time to get both of them done.
Right. Okay. Now, earlier in the show, we just talked about a new COVID variant that's out there that the WHO is monitoring. So what should we know about that? And is there anything we should do differently than what we've been doing to continue to protect ourselves?
Sure. This is worrisome indeed, and I'll tell you why. It's called the B.1.1.529 variant. It was announced by South Africa yesterday. What's worrisome is that it has more than 30 mutations on the spike protein. You may recall that the currently licensed vaccines act on the spike protein. That's how they prime the immune system to build resistance against this virus. So those mutations are worrisome. And the other thing is the R value, which is the reproductive rate for the virus, which means how quickly can a virus multiply, is actually 2. We haven't had a variant so far since this pandemic started with a R value of 2, which is worrisome also. So further tests and studies are absolutely necessary to determine vaccine effectiveness. But what it means for you is, again, going back to the same premise. Public health measures are extremely important in this time, especially winter time. And if you're unvaccinated, please get vaccinated. And if you're due for a booster, now is the time to get a booster shot.
Right. We are not out of the woods yet with this pandemic. Speaking of, vaccines and boosters, there's been a lot of talk about it for adults and children. How is that rollout going with vaccines for children and those new booster shots that are out?
So there are multiple sites available now in Connecticut, in the region, indeed, for children to get vaccinated. We do see some degree of hesitancy. So it's important that parents remember that there are 28 million children across the nation that are eligible now in the 5 to 11 year age group. And while COVID-19 does not cause as much severe disease and death as in adults, it's still one of the top 10 leading causes of death in this age group. And we've seen multiple cases, actually 2 million cases out of 28 million in this category that contracted COVID-19 during the course of this pandemic. We know this is a safe and effective vaccine, the Pfizer vaccine, which is currently licensed for use. So please get your children vaccinated. It will help protect not only them, but other vulnerable people that may be in your family or your loved ones.
Right. Now, we've been focusing a lot on the coronavirus, rightfully so, but there's another threat out there, the flu season. We don't need to forget about that. How's that going so far?
So far it's low, but flu season historically peaks between December and February in the United States. As with every year, we have an influenza vaccine that is now currently available for 6 months and above age. So if you haven't gotten your flu shot, this is the time. One reason for the lower cases compared to what we've seen historically, if we exclude last year, which had a historic low flu season, may be because of public health measures. Folks still continue to wear masks, not as much as we saw earlier, but that definitely helps.